Hi, everyone. I'm Edgard El Chaar. I have a podcast that talks about the dental issues. I have interviewed a lot of people about that subject. Now, this episode is about the dental students. You are in pre-doc and you're going through school, and I want to talk to you about the issues that you face, issues that you have to look for into the future, and choices if you want to go and become a specialist in dentistry. So now, why should you listen to me? Why should you have an advice from me? I am I'm an academician. I've done academia for 28 years, 10 years as a full-time. I used to run the postgraduate at NYU, one of the biggest postgraduate at that time. And I have written books and published numerous papers with a high H index, they call it. So my two books, and I'm going to try to reach them. One is good for a general dentist and a periodontist or any oral surgeons. It is called Practical Techniques in Periodontics and Implant Dentistry. And also, I pivoted and I did entrepreneurship. I did a master's in an MBA and a master's in healthcare leadership, two masters combined at Cornell. And I wrote a book, Reclaiming Dentistry, a blueprint for practitioner empowerment in the corporate age. So, in a short, I am well positioned to be able to give you advice because I coached a lot of dentists. I graduated over 100. That means I signed for their paper for graduation. I stood in the podium and I hugged them, and so on and so forth. So, in summary, why we're talking today is what are we getting into dental education? How can you maximize your experience? Now, is the dental education you're getting from the schools sufficient? Short answer, no. How can you supplement it? You need to spend a lot of work on reading and learning. Why? Again, why and why and why? I'm going to tell you a lot of whys. In summary, you are 4 years in dental school. First 2 years, obviously, depending which year you are in right now. If you are in the first year, you are killed with basic sciences, biochemistry, name it. They're bombarding you with this information. Second year, 3/4 of it is like that. You start doing preclinical. So now you're starting to feel what is dentistry. Now you did it all theories. Now, how can you in that time maximize your time? Is it sufficient by taking the lectures? No. What should you do? Go assist. Go to the clinics. Ask the directors of the postgraduate to ask you if they will allow you to come and shadow, or contact people outside and go and sit with them and watch them what they do. Don't forget, dentistry is a science, it's a business, it is psychology, including social perceptiveness, and Google it and you understand what I mean by social perceptiveness. In summary, how to read the patient. It is hospitality, and at the end of the day, mainly craftsmanship. What does it mean? You are learning to do a technique. I hate to say the word technique, but you are learning to do a procedure. And then in order for you to learn how to do the procedure, you have to start seeing it. Not only theory, start seeing it, watching it repeat itself multiple times. So that's how you maximize your time in dental education. Now, question is, who should I look for? People that they have built successful practices. I'm going to repeat it. People who have built successful practices. Why? Because you learn from them what they were able to do successfully. Again, why? It's a lot of aspects. First of all, in order for them to become successful, they have something special about them that attract people. Would it being their presence on social media? Would it be the way of dealing with people? How they speak to them? Because that's a very important point. And thirdly, that we talked about their presence on social media, their interaction with people, how they are efficient and quick in doing the procedure harmlessly without discomfort for the patients. Patient is your best source of referral. They will refer to you more people, not only social media. People will need you to be good and perceptible for them, nice to them, and they will come and they will refer you more people. Definitely, you have to have a lot of success. You need to be successful in your procedure. You don't make a crown and that crown pops up tomorrow and then the patient are angry and they have to do it, or they go to somebody else and they tell them, because that's another thing in dentistry, you go to somebody else and they will talk bad about you. Not because they are right, just because they want to keep the patient. That is a very bad thing. So we talked about, is it sufficient? No, you need to learn more and more and more. Now, that brings you to another thing. Are you going to get enough dental education that sets you properly to practice once you're finished? So I'm going to be very honest with you. Unfortunately, not. And you're going to tell me, is it possible? Yes. 4 years, it is very hard to compile everything and get you to have an experience in everything. So let's break it down. Look how many disciplines you have. You have periodontics, prosthodontics, restorative dentistry, endodontics, pediatric, oral surgery, and you have oral medicine, and you have also pain management. So all of these, is it possible in 4 years to master them all? Impossible. So that's a short answer, impossible. Now, how can you remedy that? Well, you have two paths. Either you do a specialty, you find your passion in it. If you're passionate in periodontics, you pick the periodontics, you go for postgraduate, and you do it. I forgot one important specialty. I hope my colleagues will not kill me. Orthodontics. You like orthodontics? You have to straighten teeth and embellishment. You like cosmetic dentistry. Now, this is another thing. Everybody claims cosmetic dentistry. Again, we're going to get to that later on. But in summary, yes, you need to learn more. And it's impossible to learn everything from those 4 years. Now, you're going to tell me I have spent $320,000 or even $400,000 paying tuition and living, and I am not getting enough education. Yes, you are not getting enough education. And that's why there is what we call continuing education. In the healthcare, continuing education is a $90 billion industry. It is an industry on its own. I mentioned it in my book, Reclaiming Dentistry. There's a lot of things here. There are a lot of things in this book that are important for you as a dental student preparing to come out. Now, the other question you're going to ask me is, okay, I'm finished. I have a lot of debts. I don't want to spend the money in buying a practice. I'm going to go work for somebody. And I talk a lot about it in that book. Now, can I summarize that in 2 words? because I have a friend here. He is an expert of giving me advices on the young generation. What do they like? How quickly or not? His name is DJ. DJ is here. He's the owner of that beautiful studio. And he tells me, cut it short, cut it short. So, DJ, it is very hard to cut it short in those kind of very lengthy questions. Now, yes, true, I wrote the book, and I can make them more episodes based on the advice of DJ. And I'm more than happy to do that. But you are going to be faced three major things, actually. I'm not getting enough education. I'm going to go and have continuing education. That means I have to spend more money to learn more on top of what I paid. Now, we're going to talk about continuing education in an episode on its own. Second, I don't want to spend the money on buying a practice. I want to work for somebody. Thirdly, I'm going to be gutsy. I'm going to buy a practice and I'm going to start from scratch. Or I'm going to start from scratch. Now, for each one, there is an answer. Continuing education, I said, I'm going to leave it alone. Specialty, I'm going to leave it alone. I have whole sessions for that because I cannot answer them, DJ. I'm sorry. I cannot answer them in short. So I'm going to go into depth in them. We can cut them down also further. But let me answer you the two questions. Should I work for myself or should I work for someone? What is the someone? Let's start with the second one. I'm not going to tell you yes and no because that's a very difficult question to answer. Who is the someone that I'm going to work for? In this book, I talk a lot about it. There is the corporate, they call them DSOs. They have been vilified. I am not here to vilify anybody. I'm going to tell you in the book, you can have it, a lot of things about it. Or you can buy your own, buy a practice and grow in it, or start de novo from scratch. For each one has its pluses and each one has its minuses. But if you ask me, should I own my own thing or I work for someone? I answer you very clearly, work for yourself. What it takes to work for myself? Well, first of all, you don't have that luxury or that thing that you have to think about is that life balance. Sorry, I have to be honest with you about it. Life balance, it's a great thing, but it's in euphoria. I know I'm going to turn you off, but I'm going to be realistic. I have children your age. So why is it in euphoria? Because I'll tell you my story. Would you allow me, DJ, to tell them my story? Okay, so that's long, DJ, I'm sorry. So it's true story, and I don't regret it at all. I came from a French system, so you finish high school, you go straight into professional school. You go dentistry. And what you do is you do 2 years of preparatory, and then you take a selection exam, and then you get to the dental school and you finish it. So it's a 6 years, depending. On my time, it was 5. Now, I flunked 1 year. I was kicked out. I had to start all over again, selection exam. See that, DJ? That's perseverance. So I got kicked out. I got a slap on my face. I was so... oh, God, I can't describe the feeling of it. I felt so disgraceful for my parents, right? Nevertheless, I went back. I secluded myself. I sat 1 month by myself, studied all over again, took the selection exam to get in. We were 85 out of 1,000, and from the 85, they took 35. Now I'm sure things have changed, and they have more spots and so on and so forth. Now, why did I go into dentistry? My mom wanted me to be a physician. My father, God bless both of them souls, um, wanted me to be a pharmacist. He wanted me to open something like Dwayne Reed. If you know Dwayne Reed, it was opened on the street of Dwayne and Reed and became a corporate, and they sold it. He said, you'll have people working for yourself. I said, oh, no, I want to work with my own hands, blah, blah, blah. So I said, I'll pick dentistry because dentistry is 5 years, not like medicine, 12 years or whatever. I get the title of a doctor. Oh, and most importantly, in the French system, we close the whole month of August. I have my whole vacation. I'm my own boss. I work a few hours and so on and so forth. Right? Cool with that? That's fine. That is, I was the pre-era of the life balance. I came to New York to do 1 year internship, international program at NYU. And I was supposed to go back, and I wanted to live in Paris, really. But my intention. Now, I was born in Lebanon. I'm Lebanese of origin, and so that was my goal. And here I am, 32 years later in New York. I knock on wood. I'm very blessed. I'm tired of New York, but I think I had a great journey. So I can give you an advice about it, life balance. So here I am. I went in it because it is like that. And unfortunately, I put a lot of time. I work 5 days a week. I work long hours. I don't regret it. It's fatiguing. It's overwhelming because you are dealing with human beings. So you have to be always on top of your game. You have to be nice, gentle, hospitable, happy, smiley, and sometimes we don't feel like smiling. But I have to tell you one thing. It is such a rewarding profession because at the end of the day, you're changing somebody's life. Yes, we are changing somebody's life. From scaling and root planning, give them health of their gums, to the most extensive thing, building up the bone and putting implant, to full set of veneers, to doing soft tissue grafting, to so on and so forth, to do sinus lift. So much things that we can do today in dentistry that on my time in early 90s, that was a dream. I hated general dentistry for one reason, is I didn't like alginates. Today, you take this vein like this, an intraoral scan, go in and you take the impression. When I was learning composite, class 3, the composite were in the first, second generation, early 90s. Keep in mind, go back in time. Dental implant was only one implant. Bone grafting was only one bone grafting, one membrane. Now you need to have a PhD to learn about all of them. So why do we need continuing education? There you go. Dentistry has exploded in knowledge. So is it enough to learn? No. You need to learn more. Secondly, open on my own. Absolutely. No question in my mind. You have to put the time. And there's nothing wrong with it. Put the time. Because you will always have time to have fun. But don't forget, you're coming out with debts. If you go work for someone, a corporation, I'm talking corporation. I'm not talking about what I'm built. I built what we call a CDE, not a continuing dental education. So collaborative dental entrepreneurship. If you work for someone like me, where you can grow on your own within it, and you can become an owner of it with equity on it and stuff, that is something totally different. It's a gift. But there's not a lot of people like me who have done this. So you have two options. You work for a corporation. Now, why is it bad about it? Again, DJ, I'm going to be very brief. You work for someone. You have no equity in the long run. You got a salary. Who's going to mentor you to get better? Don't forget, you're coming out with basic. You're going to go work for a big corporation. It's not about quality. And we, as a dentist, we love to create quality of work. That cannot be done. That's why I urge you to think it twice. Don't waste the best time of your life to work for a big corporation. Keep that beauty of our profession. Take the risk, open your own, or look for somebody like myself creating that collaborative dental entrepreneurship, CDE, in order for you to grow within it. Other summary, look for faculties that have their own faculty of own practices, not work for the government, sort of speak, which is the school, and they have a faculty practice only. They do only 1 day a week. This is not a profession about talking about theories. This is dentistry. It's a craftsmanship at the end of the day. There is the science, absolutely. You want to be doing surgery? Go learn surgery. Don't go learn how to drill a hole and place an implant because they told me I can make more money. Stick to your lane. If you want to do surgery, go study surgery. As a general dentist, I'm going to give you two stories. I love to tell stories. I'm sorry, DJ. I love it. And I wrote it in my book. In the early 90s, my friends, dentistry was based on you go to the department. Now, someone, I don't know who's the someone, created what they call the comprehensive dentistry. Early 93, 94, they introduced it. So they eliminated the departments and they wanted to create the super GP. All the dentists will be taught on the floor by everybody. Yes, there is the specialist, but everybody. And that was a wrong concept. And we've seen it. We've seen it over and over. Now, my job when I graduated in 97, I didn't have the permit to work because I finished periodontics and implant dentistry. I did a master's in oral biology. That's how I got my green card, actually. And now I wanted to go back to do the dentistry to stay in the United States because I loved the American dentistry. Comprehensive dentistry was a copy of the European system. You go to Europe, there's no specialist whatsoever. And I love that when they come, these lecturer from Europe and say, "Oh, I'm an oral surgeon." Okay, what kind of an oral surgeon? There's no oral surgery in Europe. There's only one place in the world where they call oral surgery, maxillofacial surgery, is in United States. In Europe, you are in ENT and you do maxillofacial. End of the story. Let's cut to the spade. There's no specialty in Europe. There's no recognition of periodontics, for instance, in Europe. So here you have, we are copying the system that has failed. So we're copying it. We're going back. We used to come, people like myself, to do the American dentistry, and now we are going backwards to a failed system. So now we have these dentists that they want to make them a super GP. They tell them, "Oh, you can go take a course here and learn." "Oh, no, we can teach you in dental school, pre-doc, to place an implant." Now, consider it. 4 years, my friends, you have 2 years to learn everything. 2 years to learn everything. What are you going to learn? You're going to have to do a good crown, build a bridge, or build a crown over an implant, do a couple of veneers, and know how to do scaling and root planning, and know how to diagnose periodontal disease and discover that they have oral lesion. You know how long this takes? In 2 years? You know how many hours of clinical work that it takes? Hundreds. And yet they're telling you, "I'm going to teach you how to place an implant." What is an implant? Do you think an implant is a screw that you put in the wall? I mean, this is like mind-boggling. So now, why did this happen? That's the question, right? DJ, I'm doing well so far? Excellent. I'm crushing it. So you hear that? He doesn't give compliments. I'm very impressed and touched. So, implant. Now I'm telling you a story. Again, I'm a storyteller, right? So in the 90s, I had the opportunity to start learning implants at the beginning. So the people who start practicing, they went to courses. The periodontist, I took the most prestigious practice in New York City for the Langers, and they placed tons of implants. But they took a course, right? But they had the knowledge, the know-how of biology. They're like the pioneer of periodontics, of the wound healing. So if they learned how to do surgery, that at least they have the background. You understand what I mean? Background, the basis. I always call it the Chaarism, coming from my last name. Fundamentals never change. Biology always wins. Set your goal and work your way back. Three things, my friend, that if you use that in your life, you will be very successful. Fundamentals never change. Biology always wins. Set your goal and work your way back. You can do it in business. Set your goal and work your way back. You do it in dentistry. Why? Because I say, all right, I want to do this crown. I want to prep this crown. I want to make a crown. That's my goal. But what it takes to get there, so I sit back, I look at it, and I assess the situation. So coming to dental implants, back again in the story. To dental implant, periodontist and oral surgeon were doing it. First oral surgeon, then the dental implant, the periodontist. And so it bottlenecked. So there's no much, how many you can do a day, all right? So dental industry, the implant industry, they want to sell more because that's every year they have to grow and grow and grow and grow. That's the entrepreneurship. If we don't grow as a business, then we have failed as a business. So So in order to do that, they started doing continuing education. That's how I started in education. I used to do continuing education. And I left it because it was mind-boggling. So you have these guys, wonderful people, all mean well. They come and they want to learn a technique. And here you are talking to them about biology and how you open a wound. Because the moment you take a drill and you drill inside the bone, you are starting a cascade of wound healing. This is not a screw that you put it into the wall and, I'm going to get a primary stability. No, that's not. Because so many things goes in. So many things. I'll give you an example. If you don't have a balanced bone, if I tell you that and you are in dental school and you tell me, Edgar, what does it mean, balanced bone? You ask even those guys that are going for specialty nowadays, if you ask them, because unfortunately, we'll get to that postgraduate in a later session. So balanced bone, you have enough cortical bone and marrow. Marrow is where the blood supply. Cortical, what we call it, avascular bone. So you drill that implant, you locked it, but you have on the buccal, on the outside, you have only bone, cortical bone. What's going to happen to that cortical bone, in your opinion? I'm sure we cannot have this conversation back and forth, but it's going to resorb. There's not enough marrow to support it. It's like you're putting a cork into the wine. You block the blood supply. And then you have the soft tissue, and that soft tissue starts receding with time. Huh? And you wonder why it happened. Well, because you don't have bone. The gums, the gingiva, is the cover. It's the dress that we have on the bone. So if you don't know this basic stuff, how are you going to be successful in placing an implant? 2, screw retained versus a cemented. Big dilemma about it. So implant companies start sending this continuing education. Till today, it's sponsored. And I have to give you an example. I have a gentleman, his name David Mishler. He's one of the best people that I've trained. He's now back in Utah. He was a very successful dentist in Alaska. And he had 3 practices. He was killing it. And he took courses and he was placing implants. He came, and I liked, you get 100, 120 application when you are in the postgraduate program. And I picked him out of them. I liked the profile. When I had my colleagues that they interview with me, the faculty, the decision is mine as a director at the end of the day, and we talk about the postgraduate. They told me, why are you getting somebody in his 40s to teach him? I said, I want to see him. So he came. We interviewed him. He came, this American gentleman with a wearing a suit with a what do you call that under the vest. Looked at him. He reminded me these old movies. But he was such a nice guy. And I asked him, I said, why do you want to do it? He said, because I was doing implants all along and I realized I was something missing. I'm not understanding a lot of things that I'm doing. Very smart kid, huh? He was one of the best I've ever trained. He actually surpassed me with his clinical skills. I say it with all my, you get to a confident in your life. And if your students are better than you, that's a compliment for you. So actually, I don't take it as a threat. And I always compliment him, even if he is watching. Or once I was giving a webinar to the West Coast. I'm a key opinion leader, so I'm giving a lecture. And he was on the attendees, and I was talking about him. So bottom line is, he is the embodiment of the story of continuing education. So stick to your line in summary, because DJ liked me to summarize. Stick to the line. Pick what you like. If you want to do restorative dentistry and you're great at it, stick to it. If you like endodontics and you want to become an endodontist, go to endodontics. You want to learn how to do dental implants and do stuff, go to periodontics. You want to live in hospitals and all of these things and extract wisdom teeth and whatever, go do oral surgery. But stick to something you can excel in it. I'm going to repeat it. Stick to one thing you can excel in it, because you can never be good at everything. The concept of a super GP is a big failure, and they should be ashamed of themselves that they introduced it in dentistry. I'm going to repeat it. They should be ashamed of themselves that they introduced it or even consider it to create a super GP, because that does not exist. You go to do a cardiothoracic surgery. Do you go to a cardiologist? Or do you go to a surgical cardiologist? You understand what I'm saying? You want to have a procedure in your guts. Do you go to a specialist or you go to your internist? Same story, my friends. Same story. Don't waste your time. Pick what you like and do it well, because you're coming out with a lot of debts. You're gonna rentable. You don't make a return on that investment by investing in the wrong way. On the contrary, I improve my skills, I will get my ROI, return on my investment. That $400,000 that I came out with, without counting the $300,000 to $400,000 in college, it's $800,000. Unless you come from a rich family, they paid for you. That's an investment. You invested in yourself. That's the best thing you've ever done in yourself. But I wouldn't go invest more in the wrong way to get back my return on investment. Because that's what they tell you. Go learn procedures. Oh, you make more money, you pay back what you owe. No, on the contrary, that is running forward instead of facing the fact. So, in summary, again, I'm going to say it the second time. Stick to the best thing that you like. Learn from people who have successful practices, not those theorists. Sorry, we are in a studio called theorists, but they are great theorists. But I'm talking about the faculties that talk the talk. You need the one to walk the walk. Invest in educating yourself, but in the right way, meaning what you are going to be excelling in it. Do not get distracted with this super GP kind of a thing. It does not exist. You need to put the time. You pick the profession where you need to put the time. Have fun with it. I give you one example, my friends. Have fun with it. Dentistry is fun. Enjoy it every day. Because if you are miserable and you're doing dentistry, you're going to be so miserable and you can bring it to your home, the misery. And most importantly, learn hospitality, learn how to talk to people, learn how to do social perceptiveness, because you need to learn how to talk to them. And with that, I want to thank you for listening. And I look forward to any comments that you want to have or questions. We will try to put the link for you to reach me. And I urge you to buy this book. And it sounds, like I'm promoting my own book, but it's true. It is a book where you have everything. I talked a lot about dental education in it. I give you a lot of my opinions in it. If you are a general dentist or a specialist or whatever, that book is amazing. Why is amazing? Not because I read. It's not the whole thing written by me. I had colleagues that they wrote with me, but it's made simple for you to learn and to know how to diagnose. You don't have to do surgery, but you can learn how to diagnose, how to refer properly, and how you do things properly. With that, enjoy your journey. And so I'm so grateful that you are listening to my podcast. And you can subscribe to my YouTube. I'd love to hear from you. Give me any comments you want, and I would love to answer them. Thank you.